Hi, I'm Dr. Jeffrey Riopell, and this is a series of videos, short video clips that is designed to help patients understand our practice better. The next part that I'd like to talk about is Lipo Disolve, or mesotherapy. Lipo Disolve originated in France, and what it is it's a series of small injections into the fatty tissue to dissolve localized fat. We all carry fat on some part of our body, and it's fairly difficult in most people after a certain age to reduce that fat or to get that fat to go away, even if one loses weight overall. For example, many men carry fat in the belly, and Lipo Disolve can be used in the belly for localized fat if it's not too great an amount of fat. What we do is we numb the surface with a numbing cream, and then following the numbing we inject a number of injections of a homeopathic solution called deoxycholic acid, and this is combined with procainamide, which is a numbing solution. Together, this combination helps to break down the fat cells, and the fat is then carried away from the area, both naturally and through a process called dermosonic. Dermosonic is actually a suction massage which is done on the fatty area about a week after the procedure to push the fat out of the area through lymphatics. In addition, we do ultrasound, which heats the fat and better mixes the solution so that it dissolves the fat more evenly. As I mentioned, Lipo Disolve is done with deoxycholic acid and procainamide. And although this is not an FDA-approved medication, it actually falls into the Natural Substances Act of naturally occurring products that can be used. And these products can be used by physicians when it's felt to use them appropriately. This procedure should be done in a physician's office and not outside of a physician's office because it is a medical treatment. There's some burning with the treatment, but there's little burning within several minutes to an hour. When the injections are done, you actually feel a burning sensation which lasts for a short period of time. The ultrasound helps to reduce the burning and also, as I said, spread the deoxycholic acid and procaine solution more thoroughly throughout the abdomen. This whole process is done as a series of injections weeks to months apart, and the response is gradual. It usually takes about 8 weeks after the last series of injections to see the full results of fat reduction. Side effects of Lipo Disolve include some burning and stinging, some swelling, potentially some bruising, and in less usual circumstances, lumps and bumps that can occur in the fatty tissue. The procedure should be done by a physician, as I mentioned, and it's a very good alternative to liposuction in patients who would rather not have an actual surgical procedure done. So patients often ask where Lipo Disolve can be performed, what areas of the body. Well, it can be done in the neck, for excessive neck fat. It can be done under the eyes for that little bit of fat that occurs under the eye area. It can be done to a small degree in the nasolabial fold area. It can be done for the arms, backside of the arms, the abdomen, the love handles, parts of the back, the inner thigh, the outer thigh. I think that pretty much covers all of the areas that we can use it.